Can you think of physiological reasons may have an impact on pain? Have you looked into the physiology a little bit on this?
Yeah, I think there's at least four reasonably solid reasons that explain why pain gets better when we improve our nutrition, specifically with ketogenic diets. And the most obvious one is weight. And you probably know this better than I do. Some of the orthopedic literature about, if you drop a pound of weight overall, your knees or hips experience, 4 to 5 pounds less of stress or strain on those joints. How that exactly translates to the back or the spine is not as well understood, I don't think, at least not to my knowledge. But, it certainly is going to improve situations from a mechanical standpoint on the joints. Inflammation is a big deal. We know metabolic syndrome is very inflammatory, and most of the pain conditions I deal with are at least propagated by inflammation, if not caused at the beginning by inflammation in some way. And I look at it like metabolic syndrome is like throwing gas on the fire. Somebody has arthritis in their back and they have terrible diabetes or metabolic syndrome. If I can just stop throwing gas on the fire, they're going to do better, regardless of what else I do for them. And there's a lot of mechanisms, I think, behind that, whether it's in metabolic syndrome, whether it's, just eliminating the processed foods. I think that there might be something to ketosis in and of itself that's anti-inflammatory. From a nerve function standpoint, going back even to the seizure literature, we have some evidence to say that ketosis or sort of low carbohydrate nutrition patterns are beneficial from a hyperexcitability in the nervous system standpoint. So there was a really great lecture out there. I can't remember when it was from, what conference it was, but it went through, ketosis being beneficial from a inhibitory neurotransmitter standpoint. So it augments inhibitory neurotransmitter release and quiets down excitatory neurotransmitter release in a way that reduces hyperexcitability. In chronic pain, you have both central and peripheral sensitization, where both the central and peripheral nervous systems are hyperexcitable because of sort of repeated pain stimulus. And it's not exactly analogous to a seizure, but it's sort of somewhat similar. And so that might be another way that sort of ketosis and or carnivore ketogenic style diets are a benefit. Then the fourth one that I think about all the time is mood. We're finding out more and more nowadays about how ketogenic carnivore style diets have an immense potential to improve things like depression, anxiety, schizophrenia, bipolar disorder, even neurodegenerative diseases, Alzheimer's, dementia, Parkinson's. And those diseases are so heavily tied in with chronic pain, such that if you improve one of them, the other often improves. So if I've got somebody who's in chronic pain and depressed, if I improve his pain, his depression might improve, but it goes in the other direction too. Where if I improve his depression, sometimes his pain will get better. Well, luckily, ketogenic and carnivore style diets do both, it seems like. And so that can be very, very beneficial for a lot of people. I think there's probably more mechanisms out there that we don't know enough about. I think about the gut microbiome a lot, and I hesitate to make too many claims about that because I think we're in our infancy as far as what we understand there. But my suspicion is at least getting rid of the junk improves the gut microbiome, and that probably leads to sort of better inflammatory milieu and improvements in chronic pain as well.
Yeah, I mean, there's obviously you're on social media, I'm on social media. There's a lot of people on social media. Somebody sent me a thing today from a cardiologist, said the last thing I would do, or one of the top 5 things I would never do for my patients, is put them on a ketogenic diet because, LDL and heart disease and so on and so forth. And you're seeing clearly a improvement in quality of life for these people. And so what are your thoughts on that whole relationship? Are you the net effect of improving somebody's quality of life? Maybe you're increasing the risk of heart disease. I don't know that we know that. What are your thoughts around that whole topic?
I guess the way I look at it is, barring some sort of genetic abnormality, barring familial hypercholesterolemia or some other genetic variant, like you say, on balance, we are improving all of the risk factors that we know for sure are problematic from a heart disease standpoint. Metabolic syndrome in and of itself, aside from smoking, is, arguably the biggest risk factors that we can modify for heart disease risk. And so we have this thing in carnivore and ketogenic style diets that improves every aspect of metabolic syndrome. And, LDL isn't on that definition list of metabolic syndrome. And so I get this question a lot from my patients where, well, what about my cholesterol? And I go through, well, it's probably more about what's happening with triglycerides and HDL and LDL particle size, et cetera, than the numbers themselves. And, I think when you see everything else getting better, except for the LDL, number itself, when we don't really even have, solid evidence that that's a problem, I don't worry about it.
Yeah, it's curious that metabolic syndrome, which, triglycerides, HDL, glycemic control, blood pressure, absence of presence of cardiovascular disease does not include LDL in that definition, which is interesting. Why would metabolic disease get better and LDL get worse? It seems like a weird relationship where, your heart disease risk went down, but it went up at the same time. And it's curious to say that, to say the least. Do you have any, I couldn't tell you how many corticosteroid injections I did over the years as an orthopedic surgeon. I probably did 30, 40, 50 a week in my clinic, and then occasionally in the operating room, but usually just in the clinic, probably in a number of thousands. And, you see some of the literature coming out, obviously it messes with your glycemic control, even though it's a local injection, you can still see that. Some people's blood glucose spike for days, even weeks at a time. There's been studies out there, particularly with repeated corticosteroid injections in the spine, that there's an increased risk for osteoporosis in that area. And I know it's part of your practice. You're probably doing selective nerve root blocks and so on and so forth. Do you have any concerns with that when you're sitting there going, God, I could probably fix this with a damn diet, and here I am? Or do you have any concern about that? Do you think it's a real credible issue? Is there any downside to what you do?
I think there is. The old days of pain management 30, 40 years ago, people did these steroid injections a lot more frequently than we do them now. They were doing them every 2 or 3 weeks and maybe for years and decades. And I think that really got people in trouble from the standpoint of blood sugar issues, bone density issues, like you mentioned, hormone deficiencies, heart failure, kidney issues, all these things. And, luckily nowadays, for people that don't have terrible uncontrolled diabetes or metabolic syndrome, a one-time steroid injection every so often does not tend to be too much of an issue. We space them out at least every 8 weeks or 12 weeks to sort of minimize that risk. But you're right. Though I have a gentleman who's a type 1 diabetic, and anytime he gets a steroid injection, his blood sugars rise to DKA, ranges. And so we have to be very judicious. And that's part of the reason we exist as a pain management field, is to try to find other avenues. But you're right. I talk about nutrition in those cases, especially all the time, because if I can improve your pain in a way that doesn't involve me having to give you a steroid injection, you're going to do better. Or at the very least, if I can get your blood sugar and your insulin, resistance under control such that you're able to have these injections every so often and not have tons of side effect or downside to it, that at least is some benefit.